All right, good afternoon, everyone, and thank you for joining us here today. To kick off this media availability, you have myself and our Commissioner of Public Health, Dr. Michael Mendoza. And in just a few short minutes, we'll also be joined by our former Lieutenant Governor and current Special Advisor to Governor Cuomo, Bob Duffy. We're here today to answer questions on a topic that I know is something everyone across our community is thinking about and talking about, and that's the reopening of our economy and our community. First and foremost, let me say, I understand the strong desire to get back to a quote-unquote normal, and I feel that too, and my family feels that. Governor Cuomo announced today that schools are going to remain closed for the rest of the school year, which I can imagine families across our community, including mine, are just starting to digest. While we said all along that this was likely going to happen, getting a definite announcement like this today makes it real. And I want to tell you, while we've been talking about this and saying that the decision hadn't been made yet, but it was likely to go in this direction, I do want to thank Governor Cuomo for making this decision today. And it was necessary to make it because we need to be prepared for what to do over the next course of several months and weeks when it comes to educating our children. And being able to now have finality and answers as to when we're going back to school, which will now likely be in the fall, will give us that ability to start making plans so we can continue that home education and give the support that we need to give to our students at home. We can support our teachers in our school districts so that they have the resources they need to make the plans in place to understand how they can start really amping up their at-home learning activities, and we're going to give some certainty to our children about what the next couple of months looks like. So I want to thank Governor Cuomo for making that decision today, because again, it will give that certainty to our community as to what the next couple of months are going to look like when it comes to our children. I have two children myself. I've talked about this many times. My 9-year-old daughter, my 10-year-old son, both want to go back to school, and they want to get back to having their normal routine. But now we're able to sit and talk about what do the next 2 months look like? How do we continue to put schedules in place so that they can continue their online learning at home while knowing with certainty what the next several months looks like? Because I understand, just like your children, just like mine, require routine, and will thrive in that environment. And hopefully now we can create what looks more like a long-term routine for our kids. This week, we also saw announcements about the resumption of elective surgeries, within both of our hospital systems, which is encouraging. It is only possible because of the remarkable job that we are doing to flatten the curve, slow the spread, and ensure our hospital systems are not overwhelmed. So with these two announcements, you can start to see just how complex, though, the questions around reopening can be, which is why Dr. Mendoza, myself, and Bob Duffy are in constant dialogue, collecting feedback from across our community and across industries, discussing what is going to be a practical and possible way forward, and through Bob Duffy providing that information to share with the state. Because regardless of when and how we reopen, we have to do it in a way that's responsible and doesn't throw away the hard work that we've been doing to slow that spread, but also recognizes that because of that hard work, we should be able to find a safe way to start getting things going again. And so with that, I'm going to open this up to Julie Phillip, who's going to manage questions from reporters. And we're going to start, we have Dr. Mendoza and I to ask questions of, and then we'll be joined, like I said, with Bob Duffy in just a moment. And I think he's actually joining us now.
Okay, thank you. First up, we have Brian Sharp from the Democrat Chronicle and Andrew Dennis from 13 Land.
Thank you. Dr. Mendoza, I was wondering if you could address where the community stands now when it comes to capacity for testing and where we need to be, how far we need to go yet, if there's a target number to be safely reopening.
Well, first I'll say that the words target and safe are illusions. Really what we are trying to measure is the total burden of illness in the community, because that's what's going to tell us what proportion of the population still remains susceptible to COVID-19. So testing is one way of doing surveillance, and unfortunately, it's not a perfect way. So with the molecular testing that's available now, you're seeing, almost daily expansions in the capacity for testing. And what that testing will allow us to do is diagnose people who are currently ill. And so that does have an impact certainly on the individual, knowing that he or she has the infection. And from a public health standpoint, it allows us to begin to document the total prevalence of infection in our community. But as you know, the number of tests is still a very, very small minority of the total population. And so testing with a molecular test alone will not get us the target that you mentioned. The antibody testing is coming online very soon. Unfortunately, the science isn't quite there yet where we can utilize it in the way that we'd like to. And the way we would like to use antibody testing is to know that if somebody has a positive antibody result, that they in fact are immune. And unfortunately, the science to date hasn't been convincing enough for any of us to say that having a positive antibody test means that you are immune enough that you can stop doing the precautions that we've been advising all along. So at the end of the day, what we're trying to do is do surveillance. And we're in the process of developing a plan to do that for the community. But unfortunately, even with the expansions in testing, there's still going to be more that we need to do from a health department standpoint to document that surveillance.
And I'll just let the reporters know that I believe we have been joined by former Lieutenant Governor Bob Duffy is on this session as well. Lieutenant Governor, are you there?
Thank you, County Executive. Yes, I am.
Oh, fantastic. We just started questions by reporters, unless you wanted to have any opening remarks. But, yeah. Okay.
Very briefly, I think I've talked to most of the local media earlier in the week, but just want to thank the County Executive and Dr. Mendoza. They have been great partners. My task is very simple: to listen and gather as much information as I can and get that to the governor and his team for their decisions down the road. All we've heard so far is May 15th is the construction and manufacturing date when they'll start to open up. We have no more information, but it is the meetings we've gone through. We have listened to literally hundreds of people over the last several days. It's been very helpful. Health directors, elected officials, business owners, throughout the night. We finish up today. We'll finish all 9 counties today. And it's been just a great exercise in listening. And I just close by saying, with all the concerns people have, economically, very few people, if any, I would say overwhelmingly, people understand why we're doing this. We open up, come back healthy, come back safe. I think the numbers don't lie. And I just want to say to Dr. Mendoza and his colleagues, our public health leaders, our doctors, nurses, the frontline folks with healthcare have just been fantastic. So that's my job in terms of my role with advising the governor, and certainly the support and teamwork we've enjoyed. The county exec, Dr. Mendoza, and all the colleagues around the region has been just fantastic.
Thank you. All right, Julie?
I think Brian Sharp had a follow-up.
Yeah, this is for Dr. Mendoza again. Talk of contact tracing. I'm wondering if you could discuss just the number of people you have doing that, what the criteria is for when you do it. And there's talk of amassing these large armies of folks. How many do you think you need?
Well, again, that's a moving target. So let me say a few words, and it's probably beyond the scope of a short interview to talk about the whole process of contact tracing. But essentially, the contact tracing process involves looking backwards and looking ahead. We want to look backwards. Once we identify a person who's got a confirmed result of positive, we'll talk to that person, and we look back in time to try to determine where that individual may have contracted the infection. And there's a fair amount of complexity in that conversation. And I've had the opportunity to conduct contact tracing with a number of people in this community, and it is not easy. We need to talk to these individuals, help them to remember, where they were 14 days ago. As you can imagine, that's not an easy task. And then stepping forward all the way until present day to try to figure out where they might have gotten that infection. And then going forward, from the point at which they became symptomatic, going into that incubation period, trying to identify anybody else who might be at risk for having gotten that infection from that index patient. Again, a little bit of detective work there. So as to the number that we need, it is the moving target. To date, we've had an adequate number of contact tracers. I will say that as we go forward, we will continue to do all the work that we need to try to isolate these individuals and ideally quarantine them before they're even sick. But right now we have roughly 25, and that has been adequate to date, but it's really because we've developed systems internally that allow us to very efficiently make connections between people. So if patient number 1000 is connected to patient number 400, we're able to make those connections and draw that web of contact. So those kinds of tools are what we need. Now, going into the future, really the jury is still out. My hope is that we don't need that many, because my hope is that we keep the curve flat and that we don't have any more infections. But, we need to prepare for a surge, as we have been all along. But, the details on the state program are still being worked out, and we're working very closely with our colleagues across the state to try to specify more about what's going to happen with the contact tracing process.
Andrew Dennis from 13 Lamb and Randy Gorman from WXXI. You're up next.
Hey, good afternoon, everyone. Dr. Mendoza, I want to ask you about kind of the question we always bring up, but it's an important one for viewers. Is you talk a lot about the peak and trying to avoid that peak, but where do you think we are on the timeline right now? We know we've seen some things that are working, and that's why we can start talking about reopening. But where do you think we are as far as looking ahead through the next few months? We'll be able to get to phase 2 of reopening, and through the summer months, if we continue on this trajectory.
Well, where we are today is really a function of how well we were working 2 days ago. And this isn't the yellow brick road. We don't know exactly what lies ahead. To a very large degree, our actions today is what will determine what things look like 2 weeks ahead on this path. And so it really is impossible for anybody to give you a crystal ball prediction about where we're going to be. All we have to hang our hats on is the faith that we can work together as we have to date to determine that today's path is that we can consider reopening. Now, you heard the Lieutenant Governor mention that May 15th is the next date at which we would be considering opening construction and manufacturing. If we decided today to let go of the reins and forget about all the things that got us to this point, we will effectively close the door on any possibility that we would do anything on May 15th to reopen. So to a large degree, we are in fact choosing our own adventure. We've got to do what we can today to preserve those opportunities down the road in the future.
And a follow-up for Adam, I wanted to ask about hazard pay checks, when those are going out, and if I can also cram in just about budget decisions and when you'll be making those.
Sure. So the hazard pay, my understanding was, I know it was approved just the other day by the county legislature. So as soon as that's signed and approved, and when I do that, it'll be retroactive back to, I believe it was April 4th. And so employees should start to see that in their following coming up paychecks. And budget decisions are the conversation and the planning around that is happening now. And that was the process we kicked off yesterday when we started talking about what are those, what are the revenue shortfalls that we see coming? How can we use the CARES Act funding that came to the county just last week? And we just had a meeting even today where we started to timeline out what those decision-making processes will be and what those triggers will be. The first step will be working with our department heads to devise what those plans are to cut costs and start looking at our expenditures internally. But then we're also looking, as I said, at the decisions or at the information we're going to be getting in the next couple weeks regarding sales tax and where we stand on sales tax. But what we're not going to do is make decisions on the fly. This needs to be a thoughtful, well thought out plan going forward, because we're not going to make political decisions and we're not going to make decisions because they just sound good. We have to make decisions that are right for this community so that we're providing and maximizing the services that we can provide for our residents, while also making sure that we are responsible with taxpayer dollars. This isn't something you just decide overnight. This is something you have to bring people together, and you have to develop a thoughtful plan.
Thank you.
Thanks, Andrew.
Mm-hmm.
Randy Gorman is next, followed by Jennifer.
Yeah, thanks, Julie. Either, I guess, for really anybody, but maybe Adam or Bob, in terms of what phase 2 will look like, in terms of what kinds of businesses could reopen in phase 2, has that been determined yet, or is that going to really kind of be refined as we get closer to that date?
We'll put the county exec on the spot. That has not been discussed, determined. We have no idea. And we're not holding back. We literally don't have any idea. I'm in contact with the governor's team almost daily. That's yet to be determined. That'll be really based on what Dr. Mendoza and the county exec talked about. It's going to be the public health data. That will drive decisions. that will drive what comes next. All we know at this point is that on May 15th, there will be some opening, and nothing's been said about across the board everything, but some openings relative to the two entities, manufacturing and construction. But part of what I would see my role is to get as much information from the region, and the county executive and Dr. Mendoza have been terrific, and all their colleagues. We're asking, we're listening, we're listing information and passing it along so that when those decisions are made, people have the best information to make those decisions.
So for instance, Bob, I mean, would it be premature to say by the end of June, some retail will be open, or we don't know that yet?
You know, it would be premature to say anything. And the most important thing we could do is not raise or lower expectations because we don't know. It clearly is going to be in the hands of the governor. He will make that announcement when he's ready. And just how he's looking at this whole situation, it's driven by data and analytics. And I tell people that, I know the county executive just answered the question, his budget challenges are like the states and everybody around the state. The state budget deficit is really projected to be in the area of $14 billion, according to our comptroller. That's an enormous hole. So a lot of decisions will be made, and every day businesses are closed. It reduces the likelihood of revenue from sales tax and other things. So I think everybody is suffering economically, but that's why public health is paramount. And I do think most people get that, but that will drive the decisions. And I would not even guess, Randy, where that will go on May 15th or after. I think we are sharing what we do know and getting all the information we can, representing this region back to the governor's team so they have the best information to make their decisions.
Thank you.
Thanks, Randy. Jennifer Lippy from WHEC is next, and after her, Patty Singer from Minority Report.
Hi. Bob sort of just addressed this, but Adam, how much of this is actually a county decision? Is anything your call, or do you have to wait for the governor to say X, Y, and Z can open?
Well, the way it's been working over the last several weeks has been a partnership. I mean, this is when I even talk about going back to schools, and when we close schools, and then even the decision here to keep those schools closed, we advocate with the governor's office all the time and talk to them about what we think our particular needs are. And I think that message has been received because the governor has decided to pull this out into regions, and I think that's the right approach because we've been advocating that the fact that every region's experience is going to be a little bit different. And so being able to do this regionally and then have the lieutenant governor pull the various counties together in our region, I think is the right step. Obviously, the state's going to make a lot of decisions about funding decisions and things like that, but we do this as a partnership. These decisions aren't made in a vacuum. We talk to them all the time.
And Dr. Mendoza, I'm wondering just, 7 weeks in here, what your perspective is as far as how the community is doing and what we need to continue to do as we start getting back to normal in order to not see a second surge.
Sure. Well, I think, we're doing well, all things considered. I mean, make no mistake, these are very unprecedented times. We've been through a lot together. These are not easy times, but I will say that I'm grateful to the community for having cooperated as we have. We've flattened the curve so far. Not even several weeks ago, we were talking about a surge happening in the middle of May, and there's no indication at this point that we're going to see that. And, the irony of these epidemiological models is that once you listen to them, they become wrong. And we did that. We listened to the model, we listened to the predictions, and we proved ourselves wrong in a good way. That being said, I think there's a lot of impatience, and I think people are looking for rules. They're looking for recipes. They're looking for easy things that we can do together to keep going. And the reality is that there's nothing about this that's easy. I think about my patients who say, is it okay for me to eat X or to do Y? And at the end of the day, everybody has to use their judgment. And unlike a medical decision where our judgment really only impacts us, today our judgment impacts everybody. And we've got to find a way as a community to think about one another. Think about those people in the hospital. Think about those people that we've lost from this community. Our actions impact them. And so to the extent that we can have that collective awareness, I think that's where we need to go. And I think in some ways, in spite of all that we've learned together, in spite of all we've accomplished together, to some degree, the more difficult days are still yet ahead of us.
Okay, Patty Singer.
Hi, so thank you, Jennifer. That's a good segue to what I had in mind. I appreciate that. So all that being said, testing is ramping up, but a positive test results in quarantine. It's getting nice out. People are tired, so it's like social isolation. How do you take into effect if the number of tests, people don't want to take tests because they don't want the result, that artificially deflates the number of cases as we start to reopen? What effect is that going to have? We won't know really how many cases we have.
Well, all along, we've always had a healthy perspective on the tests, one way or the other. We've always known that the under testing has limited our ability to rely on testing to make any decisions. And now that testing is expanding, I think from my perspective, we still want to have a healthy balance, that we don't want to hang all of our hopes on the results of tests, because it's only one data point, if you will, amongst many other data points. And so, I'm not really that worried that we're, going into a phase where we might see more testing. I think that's great. But I think from my perspective, we have to apply clinical judgment and good public health science to make sense out of the results that we're getting. So, to a large degree, I think we're not all that different now than we were a couple of weeks ago. We have more testing, that's good, but more information doesn't necessarily mean, more truth. We still have to think about things and be careful about what we learn.
But if people don't want those tests because I don't want to be in my house any longer, is that making our numbers artificially low? And then also, is that the point where antibody testing, which you had, becomes even more important, because then we have a truer look at what this disease has done in the community?
Yeah, I think I follow your question. I think it's too early to say that people are not wanting to get the test because they're worried about what it might show. I think my experience has been that generally people want to get the test. And, where I've had to put the brakes on is in saying, well, look, just because your test is positive or negative doesn't necessarily mean X or Y. So, applying that judgment again is where we need to go. And the antibody testing, from what I've learned in the last couple of weeks and talking to my colleagues across the state, truly none of us is hanging our hopes on these antibody tests just yet. The false positive rate is the rate that we care the most about when we're looking for a test that will, quote, clear you. When there's a false positive rate, the consequences are grave if people are to go out into the community and forget to do all the precautions that we've advised of them. So, the false positive rate for the antibody testing currently is still, unfortunately, too high for us to hang all of our hopes on it. So, like the last 7 weeks, we've been navigating, a fair amount of uncertainty. And as the tests become more reliable, hopefully some of that uncertainty will wane. But as of this point, we're still, managing a lot of uncertainty around these tests.
Thank you.
Thank you, Patty. Wendy Wright from Spectrum, followed by Christian Garzone from WRSC.
Hi, thank you. This is Wendy. I wanted to talk to you about the reopening of the schools. I mean, at this point, we won't be reopening before the end of the year, but what do the districts really need to do at this point to prepare for when they do open, whether it's summer or the fall? It seems like a massive undertaking. And could we see the children going to school with masks on? And how are you going to work with the districts on preparing for this?
Wendy, who did you want to take a crack? I can start with that. So
yeah, that's fine.
Yeah, is that okay, Wendy, or did you? Yeah. So I'll start with just say, look, I think that obviously when you talk about what is going to be the new normal, it's not going to look exactly the same as it did before, and it will all depend on where we are in the spread of the disease when the schools open. And I think that was part of the calculus in not reopening the schools for the end of the school year here, is the fact that it's not as simple as saying, okay, let's just open the doors and go back. How do we do this in a safe way so that the classrooms, perhaps you need to have safe social distancing between the students in the classrooms? How do you handle lunchtime? How do you handle recess? Do you mask the students or not? Do you take temperatures of students on their way into the door like we do at public buildings? We do a forehead scan. And then what happens when a faculty member or a student becomes sick and tests positive? What do you do with the rest of the student body within that school? Those are all the questions that have to be answered. Oh, and then also most significantly as well is transportation. How are students going to be on a bus to and from school in a safe way. Those are all factors that I think are very complicated to try to do right now between now and the end of the school year. So those are the various factors that are the various types of decisions that are going to be made, I think, when it comes to summer school in the fall, is what are you going to do with each one of those pieces? Are they masked or are they not? Are you doing temperatures or no? How do you handle a positive case? Dr. Mendoza participates in a weekly phone conference with all of the superintendents around the county to have these conversations and prepare them. And Monroe County will obviously be there as a resource for the school districts when it comes to preparing for that, because this is important and impacts just too many of our families.
Wendy, if I could add one thing to the county executive, I think
Sure.
what the governor indicated today too, he may request that every school district and school submit a safety plan before the fall semester start, which really just kind of reinforced what the county exec has said, that if they're going to reopen, it have to be reopening safely based on public health criteria, which, you know, in our county, certainly Dr. Mendoza and the county executive will be leading. But that's one of the things I believe the governor may mandate across the state before September.
Okay, Wendy, do you have a follow-up?
Okay, thank you. I wanted to just switch gears quickly to nursing homes. Is there anything more that the county can do, even though the state health department oversees the nursing homes? What more can the county do? We're hearing phone calls from people about some really sad stories, and families are still not getting all the information that they need. And that's not to say that the folks who work there aren't working very hard, but what more can the county do to step in and help with our area's nursing homes? I guess I can go to whoever wants to grab that.
Okay. So Wendy, what we do is, and I'm equally concerned, and the county is equally concerned about the status of nursing homes. And Dr. Mendoza has been fairly outspoken in his advocacy for nursing home residents in our area. And we've talked a lot about the fact that transparency is important here. The governor's executive order requiring notification of families of residents when there's a positive case or unfortunately a fatality within a facility, that they be notified. And I think that's a really good step. I think more testing is going to be necessary into the future to make sure that we have a better understanding of what is happening and what the spread is, so you can understand illness as it happens earlier, and also to be able to prevent the spread within facilities. That's going to be another necessary step. What the county is doing right now is we have regular phone calls with our task force where we have representatives from the nursing home facilities, and we're providing PPE to the facilities and an awful lot of training on how to use that and step in a way so that we can make sure that we're mitigating the spread and within the nursing homes, and that making sure that they have the personal protective equipment that they need to keep their staff and the residents safe.
And I'll add in there that, you know, as I've said before, our primary role with the nursing homes has been in a support role to the state. But one area where we have been, I think, helpful is in helping to test. And so we've developed a team here within the health department working in close collaboration with the Office of Emergency Management downtown to be able to respond to nursing homes that need testing. And so we'll go on site and help the nursing home staff collect the specimens and process them and so forth. So that's been, you know, I actually think very, very helpful. But as you know, the primary management of all the contact tracing and so forth in the nursing home goes to the state.
Thank you, Wendy. Up next is
Thank you.
Christian from WROC, and Will Astor from the Beacon will follow.
Hi, how you doing? Can you hear me?
Yes, we can hear you.
Good. I always seem to be like kind of dead last with these things, so all the good questions were taken, but I got one I've been thinking about here. It's for Mr. Duffy. So the new normal going forward is going to require a great deal of PPE. I think we can agree on that. Is there any chance, it's just a little early to think about, any chance of any manufacturing jobs being created here with the facilities we have? Some are abandoned. Any talk of that at this point?
Well, I think it's been talk of existing manufacturing entities who've already transformed into PPE. Hickey Freeman being one, Century Mold, there's many others who produced quite a large volume so far.
Yeah.
There may be opportunities down the road, but if I were to go through and talk about the future, for face masks, I think Dr. Mendoza would agree, the CDC guidelines are not for like N95 masks for us. A face covering would suffice. And so I think there could be very cost-effective ways to do that. But there may in fact be other manufacturers that are popping up. There's been an awful lot of production going on here locally with hand sanitizing, face masks, surgical masks, and some gowns. And I sense that that may continue depending on where we're at 6 months or a year down the road. I think the doctor said until we find a verifiable vaccine that can stop this, I think we're going to be in this mode of just following all the guidelines that we've talked about already, pretty much until this community, this state and country gets safer. So it could happen, but I want to applaud the companies that have already taken this opportunity, turned around, created the PPE, and many of our companies created those and donated the PPE. So at great expense to themselves. So just, I thought, great public service by many, but there could be some opportunities lying ahead.
Excellent. And just one quick question, kind of a broad-based one, but we're getting a taste, sort of a sprinkle of protests and people taking to the street. If there is a second wave of coronavirus, the outbreak, and say this shutdown continues, people are, I'm sure, here and now are saying, okay, we got this. But you give it a month or 2, 3 months down the road, and people's futures grow more and more unstable and uncertain. Are we prepared for something like on a scale of what's happening in Michigan?
Who wants to take a shot at that?
Right, Mr. Bello.
Yeah, I'm not sure the reference to Michigan, but what I can tell you, Christian, is that I understand why people are protesting, and I understand the frustration because we have been at this for a long time. People are suffering, and obviously the economy is hurting, and so I think the balance that we have to make is making sure that we take those steps on the one hand to start reopening the economy and do it as quickly but as safely as we can. And the reason why you need to do it as safely as you can is so that you avoid that second spike or another spike later on, and then it undoes all the efforts we have. But what we'd like to do, and I think this is the right approach, and I appreciate Bob Duffy's leadership on it, in the way that this is structured, is that if you open up certain segments of the economy and then give it a couple weeks, you open up another segment and you continue to grow, and you've seen this across the world, that's the right approach, so that you can see when you might have another spike, or you can start to make adjustments and give yourself the ability to do that. If you just open everything up tomorrow and do it too quickly, you'll end up with a spike, and then we'll shut back down again, and nobody wants to see that. We want to see the economy open back up again, and we want to see that happen as quickly but as safely and responsibly as we can, so that it's sustainable.
I agree 100% with the county executive, and a great example in the news just recently is California. Beaches were open, people flocked, large crowds, now they're closed. And that's what our governor wants to avoid, is opening something too soon and all of a sudden have to pull back. Because I think the county executive said, and Dr. Mendoza, it becomes doubly hard then to close a second time and pull back. So that's really why those restrictions are in place.
100%. Thanks so much.
Thank you, Christian. Will Astor from the Beacon, and then Bennett Loudon for Rochester Business Journal.
Okay, for Dr. Mendoza, what exactly does a flattened curve look like compared to the surge in terms of infection rates, deaths, and is that a plateau that you expect to continue, or how much variation is that in that flattened curve?
Sure. So as we test more, we are certain to find more cases. And so that's not the curve that we refer to when we're talking about flattening the curve. Unfortunately, as we test more and we find more, unfortunately, we're going to have more people succumb to this illness. And again, that's not the curve that we're looking at. What we're looking at primarily are the curves that relate to our capacity as a community to be able to care for those who are most ill. And by that, I mean the hospitalizations and the ICU admissions. That curve has flattened. The number of people who are admitted to the hospital in this county has remained relatively stable at roughly 100 for some weeks now. And that's well under the capacity that our systems, our hospital systems, are able to support. So we have capacity in the hospitals right now to take care of anybody who's got COVID currently, and as you know, to take on additional cases through elective surgeries and so forth. So that's the curve that we have flattened. That's the curve that we need to keep following. And if we can keep that curve flat, or ideally make it curve down, that's the ideal place we want to be, because then that way we know that we continue to have a green light to consider opening things further. If we open too quickly, or if we let go of all of the things that we've done together as a community to keep that curve flat, then we ultimately threaten our ability to open things down the road. And so that's the challenge that we're going to be facing really for the foreseeable future.
Do you have a follow-up, Will?
I guess this would be for County Executive Bello. I'm curious as to what interplay communication back and forth there is between other local governments, between the city, towns, et cetera, in terms of planning and in terms of feedback from them.
Sure. We have that's a great question. Every day we have a call that involves local officials from all over the county, town supervisors, county legislators, city council members, the mayor, that involves myself and oftentimes other officials, Dr. Mendoza as well, to talk about what's going on. What are the updates from the county, answer questions, get feedback. And I'd say that's something that's unique here in Monroe County. I don't know of another community across the state where they do a daily call at the same time where anybody can come in and raise issues, answer questions. So we do this every day. And then I also speak to my colleagues, other county executives across the state to get feedback from them on what's working and not working within their communities as well.
Thanks, Will. Bennett Loudon from Rochester Business Journal, and then Gino Finelli from City Newspaper will wrap it up.
Hi, and thank you for having this. I want to follow up on that a little bit. My question had to do with how much you coordinate with neighboring counties, especially in light of the fact that there's quite a few people who commute between Monroe County and Ontario and Livingston and Wayne and other adjacent counties. Is there something in particular that you really want to pay attention to that's going on in those counties that's important to you as you make plans for reopening?
So maybe I'll take this one to start, perhaps. You know, when we look at the hospitalization rates, we look both at the county residents as well as the region, because we know that the vast majority of people in the surrounding regions, when they need higher level hospital care, will find their way to Monroe County. So, you know, although we report the Monroe County statistics on a daily basis, we're looking at the statistics across the entire region. And so it is absolutely true that we need to coordinate, because I'll, give you an example, opening up camps. If we open up a camp in one county and the surrounding counties don't, well, as you can imagine, everybody's going to flock to the county where the camps are open. So that's an example of where we need to be thinking about this with the greater good in mind. And we can't just make these decisions in a vacuum. So I think there are a lot of reasons why we need to coordinate, because, although we are one county, we are one region. And I think that we need to view the data through that perspective.
And Dr. Mendoza, part of our duties working to support the governor's efforts, we have constant calls. The county exec and Dr. Mendoza have both been on these calls with all the health directors in the region. We have calls with all the counties. We finish up today. We'll have really covered all 9 counties in the region, elected officials, health directors, business owners, economic development leaders, asking questions and listening. And really both the county exec and Dr. Mendoza have been actively involved with that. I think the county exec said it best. I can't think of any region anywhere that has as much communication teamwork as we've seen here. And it really shows every day on the ground.
And for a follow-up, if I may ask a follow-up on a different subject, are you expecting local companies, manufacturers in particular, to develop policies or plans on how they're going to keep the workers and their customers safe? And are you reviewing those plans? Are you available to review those for those companies, or are you expecting them to actually put them in writing and present them to you?
I am not reviewing those plans, but I'll be clear. What we're asking people is this: in preparation for whatever decisions the governor will make, and when the governor makes it, it will be prudent to start looking at your own individual business, from a large company down to a small mom and pop shop. And really based on great feedback from people like Dr. Mendoza, we say if you have these 4 things, in your plan, and it really comes down to the face mask, face covering, social distancing, hand hygiene, disinfecting. Those 4 things will keep not only employees, but also your customers safe. There'll be other components that probably will come out and mandates when the state opens up and makes their decisions. But as a start, I think that's been a pretty sound advice by our medical leaders. And I think everyone I've talked to, from Dr. Mendoza, all of his colleagues around the counties, as well as our health systems, they all agree. And so there's going to be some process that will take place. Do I think every company will have a plan reviewed first? I don't believe so in terms of before things may open, but they should have one in place ready to go to operationalize in a respective business. Because on the other side of that is they're responsible when that day comes, whenever that day may be, for their employees and their customers to keep them as safe as possible from this virus. So that's the best advice we can give. And we've been trying to give it consistently. And people are already looking and working on those. Associations are working on some of those. But it will come, whatever is suggested, it comes down to what the governor is going to decide on where the expectations are. And they really have a phenomenal team working on this. And more will come when he announces it. But we're just making these suggestions and getting information back to the governor and his team.
Thank you.
One question from Gino Finelli, City Newspaper.
Hi, can you hear me?
Yeah.
All right. So, we're talking about reopening businesses and, getting the economy rolling again. But I think a lot of people are wondering, we're still being told, stay home, don't socialize, don't see your friends or family if you don't live with them and have direct contact with them. Is there any guidance right now when people can start seeing each other again and actually being able to socialize again? And what will that look like? And how can we do that safely at this point?
Well, I'll start, and then if Dr. Mendoza wanted to
Sure.
jump in, but I think that there's obviously guidelines that are put out there around masking, keeping 6 feet distance, things like that. Zoom sessions like this are important, and being able to find other ways of connecting. Nobody says, one of the things that that frustrates me about the term social distancing is that it implies that we can't be social with each other. It's really physical distancing, and it's keeping our physical separation apart. And so I think, we are social beings. We need to stay connected with folks. So I think, part of the way I like to think about it is to change it from social distancing and think of it as physical distancing. And again, that's why you have to do this in phases. So when the economy starts to phase in and more things open up, so retail opens up or other types of businesses, that's why the plans that Lieutenant Governor Duffy just said are so important, because those will be those plans, those safeguards that are in place that will follow. So that will come as you start to open more and more pieces of the economy. Those kind of safeguards will start to change. Dr. Mendoza, did you want to add something to that?
Sure. I'll just remind everybody, we've never been through this before. This is new. No matter how you look at it, this is new. And I completely understand the temptation to want to just reconnect with one another as we used to have, not even 3 months ago. But the reality is that we're still learning as we go. And I do think to Bob Duffy's point earlier, it's much harder to reopen the door and then have to close it again. And so I think the cautious approach, while perhaps a little bit, taxing on our patients is tough, I do think that in the end, it's better. And I think that's going to allow us to sort of, in a stepwise fashion, reopen things in a safe way. And, again, we ultimately want to avoid the spike. And this surge that we hope we never see, unfortunately, if it were to happen, even in a small way, can set us back much further than had we just been a little bit more, more patient for a little longer. And so that's the challenge that we have to face. And, I'd be lying to you if I said it was easy, because this is new to all of us. But I do think that if we can, take some solace in the reality that we've gotten this far through caution and patience, I do believe that a little bit more of this will give us the best outcome in the end.
Thank you. All right, I want to thank all of you for joining us today. Thank you, Dr. Mendoza. Thank you, Lieutenant Governor Duffy, for your work and your partnership on this. This is a true community effort. I'll just underscore something Dr. Mendoza just said, is that, again, we've never done this before. This is something that we're learning as we go. We learn new things about the virus over the last several months, just like we're learning new things about how to open the economy and do it in a safe way. And so I just want to add my thanks to the community for their work in coming together and partnering on this. I know it's not easy. It's not easy for my family. It's not easy for your families as well. And but we will get through this. We will get through this together, and we'll come out of this on the other side. But we're only going to do that if we work together, communicate together, and follow the advice of our public health professionals. And with that, we'll get through it. So thank you again, Lieutenant Governor, for leading this effort. Thank you, Dr. Mendoza, and thank you all.